You are in the ring with Hector Colón, 7-time national boxing champion turned nonprofit president and CEO. Hector knocks out the big issues facing social services today with high-impact leaders from around the U.S. In the Ring is a creation of Lutheran Social Services of Wisconsin and Upper Michigan and is produced by No Studios. And now, here's Hector Colón.
Hello, and welcome to In the Ring with Hector Colón, the show that gets real about the challenges facing the social services sector and the people we serve. Here's the bottom line. Pay is not commensurate to the value our colleagues provide society. Programs and policies are not evolving quick enough in order to address the true needs and whole needs of the people we serve. And the financial viability of our sector is in jeopardy. It's not a fair fight. That's why this year we're going to take on these challenges with individuals at the center of these challenges, true champions who are willing to get into the ring with me. And today I have the honor and privilege to be joined by the Wisconsin's governor, Tony Evers. He and I are going to talk about the issues and challenges that we're facing in Wisconsin, but more importantly, how we're going to knock out those challenges. I also want to share with everybody that I invited Tim Michaels, who initially was interested in participating, but to this date has not secured a date for us to be on the podcast. So unfortunately, we're not going to be able to have that interview. But again, Governor Evers, thank you so much for taking the time to be with us today. And as my coach Shorty used to say, let's go, champ.
Let's go, champ. Thanks so much, Hector. Good to be here.
So just a little bit about our governor. Governor Evers is the 46th governor of Wisconsin. He's a long life Wisconsinite, and he was raised in Plymouth, and he's also a UW alum. Over 3 decades, he has over 3 decades of experience in public education. He served as the state superintendent, public instruction, winning statewide elections in 2009, 13, and 17. Governor Evers declares that he has cut income taxes by 15% for most Wisconsin families and has directed close to $1 billion to tens of thousands of small businesses and nearly half of eligible farms. He and his wife, our First Lady, Kathy Evers, also an educator, have 3 adult children and 9 grandchildren. The two of them met in kindergarten and had their first date in junior prom and have been married for more than 40 years. Governor Evers, at some point, wanted to get you back on the podcast so you could share your secrets about being together for 40 years.
Well, thanks.
Kathy's initiatives. Yeah, go ahead.
I was going to say, Hector, we're this year it's actually 50 years.
Oh, 50 years. Oh, thank you. Thank you for the correction. And Kathy's initiatives focus on social and emotional learning, mental health, and dementia. Okay, Governor, are you ready for round one?
Yeah, I am ready for round one, Hector.
Great. So, Governor, what are your top 3 challenges, top 3 priorities for your Health and Human Services agenda? And what do you believe will have the greatest impact on the health and well-being of all Wisconsinites?
Yeah, that's a difficult question. There's many of them, and you know the way the politics works these days, getting everybody to agree on 3. But I'll just tell you where I'm at. First of all, we have to expand Badger Care. You know, by expanding access to affordable health care, that would be expanding Medicaid. We can bring better affordable health care to, well, I'd say the number is about 100,000 Wisconsinites. While at the same time, Hector, realizing hundreds of millions of dollars in cost savings. Expanding Badger Care, which means Medicaid expansion, would also help us address a wide array of health equities stemming from a lack of access to regular care and screening. So expanding Badger Care is something that's really important. And frankly, we're only one of 12 states in the country that have not done that. Really, it's a political issue, but we're going to continue working on that. Now, expanding school mental health services absolutely has to be the second one. during the pandemic, as you likely know in your position, the pandemic really impacted our kids in a real negative way, especially around their mental health issues. And so we've already invested $30 million in our Get Kids Ahead initiative, which is helping nearly every district in the state provide additional mental health services. And I've already made a commitment in my next budget. We're going to be, more than doubling down on that. We're going to invest at least $40 million in this initiative. And it's going to be a categorical aid. So we anticipate that this will be an ongoing effort and obligation for the state of Wisconsin to make sure that it's just not a one-off thing. And no matter what, whether we are moving out of the pandemic or not, and clearly COVID-19 is still impacting people's lives. But mental health issues need an ongoing revenue source for our kids. And the last one, I'm going to take a flyer on. There's so many, but addressing the opioid epidemic. It has taken a huge toll on folks across the state. And we know that substance misuse has gone up over the last few years through the pandemic. But my administration has been taking a number of steps to combat that crisis, such as implementing a pilot hub and spoke model of care and roughly investing $47 million of ARPA funds, the federal funds, to increase community level supports for people dealing with substance use challenges. And we're planning for the distribution of hundreds of millions from the opioid settlement dollars to local governments over the next 18 years. So I think those are the three most important ones that come to mind, but there's many more that we need to worry about.
Thank you very much, Governor Evers. And I agree that those priorities you outlined are really important. Expanding individual access to healthcare, specifically mental health, is something so important today. I'm so glad that you're talking about school-based mental health and your desire to expand that, but also having a continuing effort on that. I believe that that's the perfect program because it's prevention, it's holistic, it's early intervention. So let's give those kids a chance to succeed early in life versus waiting for a crisis later on. So I really appreciate that. And obviously, the opiate epidemic is a really tough issue that warrants attention and focus. And I am so thankful for the state support for our Aspen Center, that's a drug and alcohol treatment facility for men and women. And and the state and Health and Human Services played a significant role in helping us get that up and running. So thank you. And thank you for sharing those priorities. Are there any new or growing programs that need greater funding? And why do you think they need greater funding? And how would you approach the funding for some of those newer things while maintaining existing funding?
Yeah, absolutely. And as you may know, Hector, our budget, because of frankly some wise investments during the pandemic, we have a significant balance in our state of Wisconsin, $5 billion. It's actually more than that. But at the end of the day, we're hoping to invest in some things that for far too long we've passed the buck on, and some really important issues ranging from healthcare to transportation to education. There's probably too many to list here right now, but as far as investments in social services and the health and well-being of our state, as I mentioned before, obviously increase our funding for mental health services, not only for kids, but our veterans. For years we've had mental health funding for farmers, even though it's a pittance, but all that money has been used, and those dealing with substance use disorders. So we've used our ARPA funds to start doing that. Now, hopefully, what we're hoping to do is in this next budget is to invest in shared revenue, which is obviously something that most people don't hear about or understand, mainly because the legislature hasn't put any additional money into it for years. I proposed in both of my budgets some significant increases in shared revenue. which were zeroed out by the legislature. But shared revenue goes to local communities for them to fully fund essential services and the needs in their community, like EMS, public health, human services. These are the folks who are on the ground in our communities and doing some really, really important work. And for the last decade or so, even more than that, we've been asking them to do more with less. And at the end of the day, that doesn't work. And it's not just about public safety. There's no question about that issue. But just to paint this picture of this problem, according to the Fiscal Bureau, since 2011, state aid to communities have been cut by more than 9%. Cut. And think about the public safety cost at the same time, increases 16%. And the needs and the costs around health services and social services easily has increased and been impacting. So how can we expect local communities to continue doing their good work when that amount of money has been flat for a decade? It's irrational. So that's why I proposed increases last time that were knocked out of the budget. But in this next year, we will be asking for a 4% raise in every year of the budget, which actually in budget terms is a 12% increase in shared revenue over the biennium, as well as a $10 million supplement for public safety. So that'll be an investment of over $100 million. And that is absolutely, it is a top priority for me. The difficult work, as you know, happens at the local level. And if we expect the local level, they send us tax money and we don't provide any near the money back that they should get. So that's an investment. It's a top priority going forward.
Thank you, Governor, and for your commitment and shared revenue and specifically mental health. These are really important commitments that I'm proud to hear you say you want to take on. But it's a challenge in government. Right now we may be heading towards a recession. There's a lot of stimulus dollars that came out. Will that be sustainable? Unlikely. And so I know there's a lot of challenges that you will have as you continue to navigate this process. Last question in just 30 seconds, if you could share, because government can't do it by itself, right? Where does private donations and philanthropy and corporate responsibility play a role in this equation?
It always will. There's no question whether we're in a pandemic or whether we're in inflation or we're in the best of times. That's what we've done. That's why during the pandemic, we worked with private healthcare systems and hospitals to build new clinics and day mental health stabilization centers, to working with employers to provide childcare for their employees, to developing partnerships between employers and labor unions and tech colleges to access job training and apprenticeships. In fact, most of our ARPA-funded programs, the Neighborhood Investment One, the Equitable Recovery, Workforce Innovation, the Infrastructure Grant, many of those projects are public-private partnerships, so stepping up to health. So we have to make sure that we're doing our part at the state level and making sure we make those investments, but it's an all-hands-on-deck issue.
Thank you, Governor. That completes round one. In round two, we're going to talk about the rise of behavioral health challenges in Wisconsin, specifically mental health and addiction. And we want to find out what the governor's plan is to provide better access for timely, effective treatment of its residents. But first, a word from our sponsor. We're so thankful to them, M3 Insurance.
Supporting your employees is more than a paycheck and 401k. It's just a fact. People today are at a higher risk of experiencing mental illness, housing insecurity, and substance abuse. Do you know the health of your employees, your communities? How can you step up your benefits to better address their well-being? M3 Insurance helps businesses see beyond basic benefits and support employees where they live. It's a meet them where they are approach that LSS delivers to their clients every day. M3 and LSS offer real solutions to now commonplace realities that strengthen employees and inspire communities to thrive. Test your employee benefit strategy now by going to m3ins.com.
All right, Governor, you ready for round two?
I'm still standing, sir.
We alluded to this a little bit in round one, Governor, but just the fact around those that experience behavioral health issues, they're on Medicaid, and it's a real challenge to make sure that they have access to a provider. I know when I was Director of Health and Human Services at Milwaukee County, I would hear of individuals that had access to Medicaid, but couldn't find a mental health provider sometimes up to a year. And so that access really wasn't access. So I want to start off with that question. Why is access so important?
Well, it is because, first of all, we just have to accept this fact, and this is hard for some folks to do. Mental and behavioral health care is health care. It's part of our healthcare system, whether it's private, public, whatever. And so ensuring everybody has access to mental and behavioral health care is important because it's necessary for building strong and healthy communities. And we saw it during the pandemic. It made people that had mental health issues and behavioral health issues made it worse due to isolation, financial stress, and even grief from losing a loved one for their neighbors. So while we've come a long way to reduce that stigma around it, it can still be hard for a lot of folks to talk about their mental health, much less take the step of seeking it out. Lack of access shouldn't be another barrier for them to have to overcome. We've always worked to invest in improving access to quality, affordable care, especially mental health services. And now's the time, even more urgently, to deal with this issue and to get over those stigmas due to the pandemic.
Thank you, Governor. One of the challenges around access, I believe, are relating to the reimbursement through Medicaid. And so the reimbursement is significantly low, I think lower than some other states or many states. And that prevents barriers for those providers to be able to provide those services to those most in need. Do you have any thoughts around increasing the rates of reimbursement for Medicaid to improve that access?
Absolutely. This may surprise you, or you may say, well, it's typical. We'll see. In my last budget, I proposed a 40% increase in reimbursement rates for outpatient services for mental health and substance abuse. Republicans cut that down to 15%. Of course, that's better than no increase at all, but we're going to continue working to make sure that those investments needed to close these gaps. And I just want to cycle back around the issue of access too, because it is one that's really important. And one of the things that obviously we found out during the pandemic, and we started investing in it with federal funds, is the whole issue of telehealth services for kids and adults. So that folks can call a healthcare provider, counselor at home, at school, at the local library, so they can access the services in a way that works. Actually, I utilized telehealth during the pandemic for several doctor's appointments, and it saved me lots of time and effort. And I know that it's worked very well in the mental health and substance abuse areas also.
Absolutely, yes. Thank you. Governor, let's talk about social determinants of health. So clearly, the research shows that it is really the social determinants of health factors that really improve the health and well-being of those in Wisconsin. So when we talk about social determinants of health, just for our audience, we talk about housing and food security and transportation and medical and jobs. All of those things are really what improves the health and well-being. So tell us a little bit more about your thoughts around that, and will you have a strategy that focuses on the broader social determinants of health?
Yeah, and that is around connecting the dots. I use that term a lot of time internally, and it's just for me, it's a fancy way of talking about connecting the dots on housing, air quality, water quality, access to good jobs and good schools, and even within those areas, also connecting the dots. And I'll use affordable housing as an example. There's all sorts of research around the issue of making sure, how important affordable housing is, but also, having someone on site at the affordable housing, kind of a navigator that can get people to, whether it's a health issues or whether it's a justice issue, you name it. But it's clear that if we look at the research, there's all sorts of ways that we need to connect the dots. And that's just a small one, but whenever we do an affordable housing project, we really encourage the folks that are using our funds to make sure that those navigators are on site. One of the other things that we're doing is with our Office of Environmental Justice. We created this office at the recommendation of our task force on climate change. And it's focused directly on how climate change and environmental issues are disproportionately impacting communities of color. We've also made numerous investments that directly address the significant health inequities that are holding our cities, communities back. And DHS has been leading an ongoing work around the issue of reducing infant and maternal mortality. And just this week, we did another $16 million investment to close gaps in maternal and child health outcomes in collaboration with the Medical College of Wisconsin. And so I believe connecting those dots is exceedingly important, because if we grab at, I'm not belittling any comments that I made or you made or others, but grabbing at that shiny object and thinking, okay, we got that taken care of, that just isn't enough. Whether it's around transportation or transit, we have to have a good transit program so that people can either go to work, go to a doctor's appointment. All those things are important. We're investing in them the best we can, and we did a lot of that during the pandemic.
Thank you, Governor, and also for your just your commitment to affordable housing. And you talk about the navigator. When I was at Milwaukee County, we initiated the Ending Chronic Homelessness initiative, which ended up saving Medicaid $2.1 million by providing a home to those that really needed it, and with no requirements. We just wanted to love them, care for them, and made sure they had a safe place. And the outcomes were pretty remarkable. Not only did it save the state money, but it also saved our behavioral health system almost $1 million as well. So thank you for your continued support and efforts on that. On this question about social determinants of health, are there better ways that healthcare and the social services sector can better collaborate? Social determinants of health is what we do. It's what we live and breathe. It's what we've done for many, many, many years. It seems like healthcare is starting to get into this space. Do you believe that's a good idea, or should we collaborate with them so that we can keep our expertise and do what we do best through that collaborative effort? What are your thoughts around that?
Yeah, and within social services is a great example of that, Hector. It is an organization that's providing direct mental and behavioral health care, but they're also connecting folks to other things they need to thrive, like housing. So it's not helpful for us to be siloed in our work. There's no question about that. So we've encouraged interagency partnerships among our cabinet, especially. That's been really important. And at the state level, we're a bureaucracy, and I'm not saying that in a negative way, but we also making sure that our cabinet agencies, children and families, and other, whether it's DWD, workforce development, health services, they're all working together. And actually, Wisconsin Economic Development Corporation's taken a lead also. So we see people working together and making sure that they're addressing people's needs in a holistic way. So we need to do more of that, no question about that. But I'd also like to see more healthcare organizations and social services organizations partnering together, connecting the dots like you do in your world at LSS, and making sure folks are getting the wraparound services and other care that they need.
Thank you. We have some great collaborations with some health systems, and we want to continue to expand that all across the state. So we look forward to doing that to improve the health and well-being of those amongst us. All right, Governor, that completes round 2. In round 3, the governor and I are going to be talking about preventative care, reimbursement, and outcomes related to behavioral health care for individuals in Wisconsin, regardless of where they live. Ready for round 3?
I'm still standing.
So, what are your thoughts around paying for outcomes versus quality and individual contracts based on the cost of services? And I'll share a few words first. When I was at the Milwaukee County as the Director of Health and Human Services, I was starting to move in this direction to pay for outcomes and quality. And my desire was to pay more for those that had better outcomes. But I wasn't quite able to finish that project because then I ended up moving over to LSS. But what are your overall thoughts around paying for value and for outcomes versus for the cost of service?
Yeah, and to be honest with you, Hector, I just think there's benefits and disadvantages to either approach. And I know there's still a lot we can learn and from other places that have implemented programs based on outcomes rather than contracts. For example, there's certainly some instances where it could make sense, particularly in the wake of a pandemic. We saw a lot of need for flexibility in contracted services like shifting to virtual communications and telehealth and so on. But as a state, we also have to work on being accountable to and transparent around taxpayer dollars, which is something that's important to me as governor and as taxpayers, frankly. So we have a responsibility to make sure any approach we take is transparent and accountable while also balancing the need to, frankly, meaningfully measuring outcomes and the quality of those outcomes. So no matter what approach we take, and I'm not necessarily I'm trying to avoid your answer, but it's important to me that we follow the science and that we use every tool we can to make sure critical services are getting to folks and that they need, and that taxpayers are being used effectively and efficiently. My guess is at some point in time we will be able to work on the outcomes thing in a more broadly and important way.
Great. Governor, how does your agenda focus on prevention services? Prevention is hard to measure, right? But very necessary to move towards an upstream approach versus a crisis approach. What are your thoughts around that, and what is your commitment on prevention?
Yeah, obviously it's important if we don't want to overload the system with essentially repairing folks and dealing with folks that have such chronic and difficult lives that they're living. So prevention is really important, but it is again about connecting the dots, and we hit a lot on those today, whether it's job training, childcare, so folks can get to work, affordable housing, a good, obviously a good public education system, telehealth. Addressing all these issues is a critical way to move our state forward, and it's around prevention, and it's in and of itself. So in particular, we can look at the way we've invested in substance use prevention and treatment so that people can live healthier, more productive lives. We've dedicated millions of dollars towards addressing substance use disorders and healing in our community, and a significant portion of that has gone towards prevention services and activities. For example, we put $9 million this last year to 23 county agencies in 5 tribal nations to provide prevention services through the federal state opioid response grant. And we've piloted a new model of care called hub and spoke, which has been successful in other states to ensure folks get the full spectrum of services they need at home. As I mentioned previously, we want to expand Badger Care to ensure Wisconsinites can access affordable health care, and that in and of itself will be preventative. So clearly, we have to do that. I know a lot of times we end up in the fix-it stage, but if we look at these issues holistically, prevention programs, whether it's opioids, alcohol, tobacco, other drugs, we've provided that resources for that, and we're going to continue doing that.
All right, Governor. Now it's the most important question. How are you knocking out, how have you been knocking out 2022, both personally as well as professionally?
Well, it has been quite a year, and as I mentioned before, one of the highlights was Kathy and I celebrated our 50th wedding anniversary this year, which pretty jazzed about that. Otherwise, we're spending 2022 pretty much the way we have for the last several years as governor. I love traveling all over the state and talking to folks in every community is how they're doing, what we've accomplished, what we can do at the state level to improve their lives. And beyond just last year, I'm proud we've been able to get through this pandemic in a really important way. Obviously, it's still there. People have to be safe. But making important investments in education, housing, healthcare, substance use prevention and treatment, in addition to providing $1 billion in supports to small businesses in our economic recovery, we brought broadband over 387,000 people in the state, or households, not people, households, and improving lots of roads and highways. So it's been a great couple of years for me personally and professionally. Still standing. We've got a lot more work to do, and I'm excited to get to work.
All right. Well, thank you, Governor. I think you knocked it out. Really appreciate your time.
Thanks so much, Hector, and have a great day.
You too. All right. That was a great show with our governor. I want to give a little bit of a recap. You know, he talked about his priorities, specifically Badger Care and expanding Medicaid. And he talked about how doing that is the right thing to do because those are individuals that need that support and care. But it's also smart, and there's cost savings that I think we will realize as a result of moving towards that. He talked about school center mental health and how he wants to advance this by 40 million, and his commitment to continue funding over the next years is really impressive. You know, another priority he talked about is the opiate epidemic. And I shared with him how we were so thankful to receive support from the state and the legislature to help get up Aspen Center in Waukesha, Wisconsin. You talked about mental health for veterans, for kids, and we need health and transportation and education in order to fully realize our potential. Talked a lot about access. He said that behavioral health is healthcare, and we agree at LSS. And behavioral health is so important right now. So many people are struggling with mental health and addiction, and now more than ever, it's really important to put the resources forward to address those challenges. Something I did not know, he proposed to increase Medicaid by 40%, but he was lucky to collaborate with the legislature last year to get a 15% increase, and he wants to continue to propose more increases on Medicaid reimbursement, again, which will be so helpful for those providers to make sure that they can serve individuals who have insurance, who have incredible odds stacked up against them, and need support now. They can't wait another year or 6 months. Talked a lot about telehealth and how that's a vehicle to serve. We talked a lot about social determinants of health, and the governor described it as a way of connecting the dots. Affordable housing, he talked about climate change, health equity. We talked about collaboration and collaborating. The governor shared how he's trying to get his cabinet secretaries to collaborate across agencies, which is so important to share common goals, to share resources, and also to share an approach that will yield the biggest and best impact for all of Wisconsinites. So we're happy to hear that is happening. We talked a little bit about moving towards a value-based approach of reimbursement. And the governor was honest. He said that there's benefits to that, but there also are some challenges. So I got the impression that he thinks value but cost of reimbursement services also is something that he thinks is of value as well. We talked a lot about prevention, and I like the way the governor shared his thoughts about how we are overloading the system today by not focusing on prevention. So that was a good insight. And last but not least, I want to just thank the governor for his 50 years of marriage. And we want to celebrate that with him and his wife as a very big accomplishment. And again, at some point, Governor Evers, I'd like to learn more about how you were able to do that. So with that said, thank you so much. Next, I'm going to get in the ring, not with one, but with two sector CEOs whose notable leadership has secured recognition by one of the most largest and most respected health and human service networks in the United States, Lutheran Services in America. We will hear about their expertise and experience in innovation that addresses complex business issues, justice and equity in our work with one another, and growth through mentorship using servant leadership tenets and tools. You can find out about more with In the Ring with Hector Colón podcast and all of our episodes and our website at lsswis.org/inthering. Let us know what you think about this show and what you want to see in future episodes. Like, follow, and share at LSSWIS on Facebook, Twitter, and LinkedIn. And please subscribe to our YouTube channel so you don't miss any of these important conversations in the future. All right. Thank you, Governor Evers, and to all of our listeners. Until next time, con mucho cariño, with much affection. Bye.